Savida. We are from Ahalya Medical Group. As you know, January is the Cervical Cancer Awareness Month. So we are trying to do something to prevent cervical cancer. It's one of the most important female cancer globally. And the important thing is it can be completely prevented, almost 98%, because it's caused by HPV virus. We'll be giving you some important information so that you can get screened and get vaccinated and prevent the cancer.
So as Dr. Savida was saying, cervical cancer is most commonly caused by an infection with a virus named as human papilloma virus. This is a sexually transmitted infection, so it comes through sexual contact and also through skin-to-skin contact. Almost 80% of these infections get cleared by themselves, that is, the body's natural immunity resists the infection. But when it persists in your body, that is when you're at risk.
So we can improve our immunity, cellular immunity, by taking HPV vaccines. It's given routinely at the age of 9 to 12 years for young girls, and you can even take it later if applicable, if advised by your doctor. And you can avoid the things that reduces your cellular immunity, like smoking. The risk increases in HIV and like immunosuppressant drugs. So you have to be more cautious in that case.
Exactly. Yes, and the other method of screening is by regular Pap tests. This is the most important method after the HPV vaccination. This is a simple test done in the OP, which hardly takes 10 minutes, in which the cells of your cervix are taken by a small brush and it is examined to see for any changes which have a risk of leading on to cancer later. So that is why it's called a screening test, because it detects the changes even before you do develop cancer. This test is done once in 3 years. It is recommended once in 3 years after the age of 21. And your doctor may also advise you to have an HPV test based on your risk and your age group.
So if you do